Hi, welcome to another show of Meet the Author. Tonight we have the book Sailing on Broken Pieces by Dr. Gary Rhule. When Dr. Gary returns home from medical training, he finds his brother diagnosed with schizophrenia. Facing the unknown, he calls on vital life skills learned in the emergency room and lives parallel lives where the unexpected is the daily way of life. A poignant story from the triple perspective of a doctor, sibling, and caregiver, Sailing on Broken Pieces takes you into the action of the fast-paced emergency room and into the life of a person with mental illness. The result is an energetic account that looks at mental illness and caregiving in a refreshing way. Welcome, Dr. Gary Rhule.
Thank you, Jason.
My pleasure to have you here.
Thank you.
Well, Gary, you brought this prop with you. Okay. I told you to bring a prop to the show,
yes.
Right? Tell us, what is this prop about?
So this is a ship, and it means that my family and I felt as if we were in sinking the ship, and we needed someone to throw us a life raft. Mm-hmm. So the ship really represents just that journey of living with mental illness.
Very nice. So tell us a little bit about your book and why you wrote it.
The book actually is my 2012
New Year's resolution.
Thank you. New Year's resolution. And I had a bucket list. So in 2012, I was turning 50, and I wanted to actually take this off my bucket list. Mm-hmm. So on January 1st, 2012, I started writing. My birthday's in July, and I was very determined to get it done by July 18th, which is when my birthday is.
So what Gary's teaching us is to set a goal.
To set a goal, absolutely, to set a goal.
And you'll meet your goals, right?
Absolutely.
And I only say that because in your book you have different tips about how to improve your life, how to deal with things that you, as an emergency room physician for many years, have gathered insights and put those into the book. So setting a goal is one of those tips.
Absolutely.
So why did you decide to be an author?
I love writing, and so when I was in college, I worked for the student newspaper, mm-hmm. wrote a couple of articles for the Amherst Student, and despite being in medical school, I got very busy and could not then write. But I liked writing, I love reading, and so I wanted to, and I really admire writers actually, and I wanted to have something that was like that. Every day I said, wow, that's really amazing that someone could write a book. And I thought, well, let's see if I could do it.
And you are originally from Jamaica, correct?
I am.
And what time did you come here? What age did you make it to the States?
I was 14.
14, and you said you had some family members here that you're able to stay with them or join them, or they helped you out a little bit?
Absolutely. So I first came here, we lived with my father's parents, with my grandparents in New York City, in the Bronx, and then after a year came to Connecticut.
Oh, a New Yorker.
Not a New Yorker, but to the Bronx, yes.
Bronx. So what made you decide to go into medicine and then into emergency room medicine, which, by the way, I also work in a hospital. I was just in the emergency room today. So I know what it's like, and I can relate to Dr. Rhule and about a lot of the things he says in the book, and we'll have a little bit of a reading. I also relate to a lot of those things because I experienced them myself working in the emergency room from time to time, mm-hmm. and in the ICU. So tell us how you got into that.
So I like science and math, and I'm very curious. And so actually as a child I had asthma. My brother had asthma as well. And so I interacted very often with nurses and healthcare providers. My aunt is a nurse, and so they would come home and talk about what they saw in the emergency room or in the hospital, and I really just thought it was very interesting.
So you had exposure to the medical profession from different sides. Mm-hmm.
And I just thought it was really cool to find out what's going on with the body and just really science in general, just being very curious.
So it pays to be a little bit sick, you know?
It does.
In the end. And why an emergency room doctor?
I guess in some sense I am an adrenaline junkie, and I like the excitement of meeting different people coming with many different things. It could be a headache, it could be chest pain, it could be a cold, and I just find that it's really interesting to be in the thick of everything.
So Now, your book talks about caregiving for a member of the family, but I think it's like a book in general is about someone who has to make a decision to help somebody who has a problem, even an elderly parent, that you'd make a decision about being a caregiver, and I could relate to that, and people who might want to support or help in making a decision, should they be a caregiver, I think this book is excellent, although you talk about your brother specifically who has schizophrenia, and you had to decide to become a caregiver for your brother. Now, from what I got, the main idea here in the book is that you used your experiences as an emergency room physician and you juxtaposed it with what was going on in your daily life as you were evolving to become a caregiver for your brother who is older than you?
Older than I am.
Older than you. Mm-hmm. So, would you like to read a passage from your book?
Absolutely. So just to set it up for you, this is in the emergency room, and the patient comes in with a broken bone.
Oh, you found it. Okay,
I
that's my
found it.
favorite part. I love that.
And this is a nurse, and so it starts. She ran down to the Pyxis machine to get the medication. She's been working in the emergency room for 20 years, yet she was always pumped up in this hectic, fast-paced environment. She was one of those adrenaline junkies who loved to be in the thick of everything and having her finger on the pulse of it all. Paloma punched in her access codes, and the Pyxis machine's door clicked open. She grabbed a vial of the drug and quickly ran back to the room. "Look at that ankle," she said again. He fell off a ladder trying to reach up to clear the leaves from his gutters on the roof at his house. I had already lifted the sterile cover that she'd neatly placed over the right ankle so that I could take a look at it. "Uh-oh," I said out more loudly than I had intended. I suppressed a wave of nausea that threatened to bubble up from my belly. Mr. Iguzi's right ankle and foot looked like a mangled dinner fork. The foot was practically dangling off its hinges. The tibia, the larger bone in the lower leg, was sticking right out of the muscles and skin. All the bones and tissues of the ankle and foot were displayed for the entire world to see. Frank Netter, the medical illustrator, could have drawn the ankle's anatomy from this wide open view. Surprisingly, there was little blood despite the magnitude of the injury. The lower part of the leg was completely open, broken, and obviously dislocated. I shook my body in disbelief as I imagined seeing him falling and hearing the snap and loud crack as he fell off the ladder.
Well, very good. Was that like the worst case you had in the emergency room?
No, that's one of the milder ones, actually.
That's
one of the milder ones.
So, you also told me that you just came back from a book signing in Harlem, right?
Yes.
And so tell us a little bit how that went and what people do when they meet you and why do they want to, well, when I say what they do, I mean, what are they interested in about your book? What do they say about your book? And also people who read your book, what have they been saying, how that has affected their life?
So the event actually is very good because there are many other authors there with different kinds of books. Initially, I think they're attracted to the title, Sailing on Broken Pieces. Initially, they approach because they're not really sure what that means, and they see the book, a beach, a boat, the beach, and the anchor. So they're kind of drawn in by that. And but then when I describe what the book is about, then they are very engaged with that.
It's not about summer vacation, sorry.
It's not about summer vacation. I think that this book is different because it talks about really the experience, and it's not a medical text. So it talks about both the experience of living with someone with mental illness, but it talks about just the excitement of that, as well as being in the emergency room. But it also gives you tip boxes about how to cope, how to recover, and really just how to cope with really any changes that you go through.
And I must say, I read the book, I really enjoyed it. It's very well written. But I must say, you know, some people will be turned off or shy or scared because the book with mental illness in it too, but really, or also about things that happen in the emergency room. but it's written in a way that doesn't scare you off and actually helps you educate, and it's humorous and a lot of life lessons. So if you're shy about that topic, don't be if you want to get more information from this book. It's very well done in that respect, and not something that is totally gory or scary or depressing that you would want to, if you don't like those type of books, you'd want to stay away from.
Mm-hmm.
So I thought it very very positive and uplifting book. So what do people say to you when they read? Have you heard from people who read the book?
Absolutely.
Well, actually, you do have good reviews.
Yeah.
So give some examples what people said to you or how it changed their life.
Right, so one person actually emailed me and said that she had read the book, was very inspired because of both things, because of the way it's structured, from the emergency medicine and the mental illness, and the fact that she had family members who have mental illness in her family, that it inspired her to do two things: to share the book with them, as well as to address some of the other issues in her life. Not necessarily mental illness, but changes that she was going through. So she felt inspired by that. That's one thing. And I think people are surprised because of the juxtaposition of the ER and mental illness for that reason.
Mm-hmm. Very nice. Now you have gone to different library occasions, and you told me that people just buy the book, which is really great to hear.
They do.
I mean, you said you sold personally thousands of books?
Yes.
That's outstanding, because I myself also, as an author, can relate to that. And that's a pretty good number. I mean, people really have to like the topic to purchase that many number of books nowadays. Mm-hmm. So congratulations, and you actually won an award.
I did. I won an award.
Well, your book won an award.
Yeah, the 2014 USA Best Book Award in the category of psychology and mental health.
And that's a pretty good category, psychology and mental health. That's excellent category. A lot of people will be, maybe they'll be reading it in college.
I hope so. I hope so.
Tell me a little bit about, you said you were also thinking about writing a book in the future. Were you?
I am.
You are? And can you say anything about that?
Yes.
Or it's a secret?
No, it's not a secret. I'm working on the second book.
You were already started?
I already started.
Oh, good to hear.
And the way I kind of write is I start with the premise, kind of what I want to actually have the premise be.
Success builds on success.
The premise. And I have the outline. And right now, it's emergency medicine based.
Mm-hmm.
And what I'm actually doing is researching the character's work.
Mm-hmm.
What it's like, the person I'm doing, what his work is like. So that's kind of what I'm doing with the research.
Mm-hmm.
Both his character and then the setting for where I want this to actually occur.
So continuing on with the same thing.
Yep.
I'm just going to read a part of the book that I had marked off, and I'm not really sure that this is the part that I wanted to read, but the whole book is written so well that it doesn't matter. It'll be good anyways. So, she was definitely too thin. She appeared as if she missed the next glass of water or another meal. She would collapse unconscious on the floor, exhausted from dehydration. She must have been homeless. Her clothes were tattered. Her blouse hung loosely on her body. She wore pants that were held to her waist with cords that were twisted into intricate design. Her hair was in its natural state, but the tresses were matted and mangled together. Some of the tresses spiked upwards, creating the effect of a tiara. Her skin was the complexion of the deepest mahogany. It would have been unblemished except for the acne scattered on her forehead and cheeks. She wore heavy makeup, and her lips were firebox red from over-applied lipstick. Once she had been absolutely beautiful. You knew now that her mind was completely gone. But you also knew that at one point in time, she was able to stop people in their tracks to stare when she walked into a room. She still had that same effect on them. Very well written. Now, just by reading that, I remembered one of the important things about your book. That you had told me, I asked you, how come a book about emergency medicine can fit together as a topic with a book about caregiving and mental disorders and mental health or schizophrenia? And then you told me, which I knew and I never really knew, that a good percentage of people who come to the emergency room are in a certain mental state, Also, a lot of patients who have mental disorders end up in the emergency room a lot, and I know that, and people might not realize that, but they might have more accidents, more medical problems that need addressing. They get seizures, for instance, and they have to come to the emergency room because their medications, they forgot to take it, whatever. That you told me that there were a lot of mental disorder issues that you had to deal with as an emergency room doctor, and therefore that experience has helped you to write about the other issues in your family. So would you like to mention something about that in your day-to-day job as an emergency room doctor?
No, certainly. So many persons who have mental illness, the emergency room is a place of refuge for them, whether it's schizophrenia or trauma or alcohol or substance abuse, because they come there as a refuge. Sometimes if they're homeless, they come there. And so that's one segment that we see. But many persons, from whatever reason, from chronic medical conditions, cancers, diabetes, or any type of grief reaction, just really extreme stress, we see that all the time. And so you do get to interact with many persons who are going through. Stress is not a mental illness problem, but chronic unrelieved stress can lead to depression and anxiety. So we cope with those on many ways.
Now, that brings up a good point. Now, I was once a biofeedback therapist, and I dealt with just what you're saying, chronic stress as a disorder. And the one thing and I'll ask you, this has nothing to do with your book, but this is something that we always got a referral to the biofeedback lab. Somebody who goes, and I'm sure many people can relate to this, somebody goes to the emergency room because they have a chest pain. They do all the tests, and they say, oh, your heart's okay, there's nothing wrong, it's stress, right? Now, I don't think so. I think there are physiological things that can cause pain to the chest, and it doesn't have to be necessarily the heart. It could be muscles, could be other things too, and maybe not necessarily stress, but stress makes everything worse. But what's your take on that when a person comes to the emergency room, they say, I have terrible pain in my chest, and then the doctor says, oh, no big deal, it's not a heart attack?
So actually, I buy into the belief of integrative medicine, and St. Francis has that where you can actually combine both mind, body, spirit, and to really get well, to use the tools available to you. So some of it is biofeedback, and some things it's non-traditional medicine or alternative medicine, and to address the physical piece and the mental side. So I embrace it actually, because I think
you're not telling the patient just to go home. It's not a heart attack, but
it's real.
You're saying it's real. It might not be the heart, but we're going to take care of that because it's real to you.
Absolutely, it's real.
And it's real. It's physiological. It's not cardiac. Very good. Do you have another example of a type of pain or stress that they come to the emergency room, and in the past they would be sent home, but nowadays it's a little bit different? Is there another one?
Another one?
Maybe pain itself. A lot of times pain is not measurable. Like different people can have the same sort of pain, and they'll have a different reaction to it. Some people are very sensitive, some are not.
We see a lot of people who have back pain or migraine headaches, and we will go through the testing, and the doc will say, there's nothing wrong with you, but the truth is there's a reason why they're feeling that way. And sometimes the diagnosis isn't discovered that very first day. But I think, though, the attention should be to other things in their lives, and not to say it's all in your head and there's nothing real, because we know that's not true.
And how did it work? How did it work out in the end? Maybe talk a little bit about the process of how you had to take care of your brother, which is written in the book, and in the end, what was the final situation? How did things turn out?
So I was living in California, and he had a very long hospitalization for about 9 months, was to be discharged. Prior to that, he was homeless. And then I knew that once he was discharged, he again would have been on the street. And for most families who've gone through this for many, many years, you come to a point where you realize you actually have to do an intervention.
The revolving door syndrome.
Right. So I came home, and I really didn't know what I was getting into, but I knew that I had to do an intervention and to actually intervene. So I came back to Connecticut and decided to actually have him live with me. And it's not always rosy. I mean, there are good days and there are bad days. But he's doing remarkably well on medication, medications, on therapy, and he's doing really, really well.
So you're able to like help him make sure he's taking his medication.
Absolutely.
Because I also know a major problem are people who have issues, and especially mental issues. They don't remember to take their medications. They also have memory problems.
Sure.
They don't remember to take the medications, and then their problem starts to happen, and then they further don't take the medication, and then they have a blow-up of their issue. And if somebody's not there, a family member is not there to watch over them, you know, that's it. And if they're not in a home of some sort, no one's there to help them take the medications and watch what's going on with them. That's also...
Yeah. So the families need support just as the individual needs that kind of peer support and family support. I think you do need that supportive network.
Are there any places you're going to appear to give a talk in the future? Do you have anything lined up right now?
The next one is the 22nd of November.
22nd of November. That's
but
right
it's
around the corner.
Right. It's a Bloomfield Learning Center, and they have a
The Bloomfield Learning Center.
But more than one author there. And that's the next one that's lined up.
Oh, very nice. Is there like a topic of the day, or it's just having different authors?
Different authors presenting their work. And it's really more of a fair, so there are other things going on as well.
So they have an author stand there. Very good. Anything after that happening?
I'm planning something for February, but that's not definite. So February 28th, I believe.
And do you enjoy doing the author events?
I love doing the author events. I mean, just like with in medicine, part of what we do, and as writers and as authors, is to really connect with people. So I like the fact that you're meeting people who are very, very interesting. They have their own stories to share your experience, to share their experience, and to really help everyone live better lives. And I think that's what we do as people. And if we're not really doing that, I don't think we're very happy.
And how can people find out more about where you're going to be giving a talk? What is your website? Can you tell the people?
Certainly. It's www.garyrhule.com, GARYRHULE.com. And it's posted where I'm going to be. It's
posted. Very good. So is there one more reading you'd like to do? Maybe a tip, pick a tip from the book?
Right. So the tip box is at the very end. And because I believe in balance in your life. So the tip box 6 says, take a day vacation and enjoy yourself. 2, anchor yourself in love and with loving people all around you. And then number 3, always go to the root of your stress and write out the actions that you will make to calm your mind. Keep it on your desk or a visible space to remind yourself what you will do to get there.
And the last question, well, actually I'll ask 2 more questions. How long did it take? I know it took you a year to write the book, but the information that you have here, how many years does it expand, the experience? What are we talking about here?
It goes really back to my childhood when I was about 7, and all the way up to, I'm 52. So it goes in
So we're talking 45 years.
45 years.
Of experience that you put into the book. Okay. And very good. So, my last question, I almost forgot, but what advice would you give to an author or somebody who wants to write their story or their memoir or their experience? Something that you have learned from this whole experience of being an author now, what would you advise? I know that's not one of the tips in the book. But what would you advise another author or would-be author?
Right, 2 things really. One is that I think the biggest challenge is starting. So just start to write. I wrote from my experience. I think that made it easier. But just to start writing and not to worry about whether it flows, just to start writing. And then that's one piece. And then the second piece is to not do your own editing. Because
that's really important.
Not to do your own editing, because I think what happens is you know the story, and so you read it, and it makes sense to you, but someone else reading it doesn't understand what you're writing. So definitely not to edit your own work.
That is very important. I agree.
And to get it edited.
And to get it edited. Yeah. You cannot be a professional author without going to an editor. Period. There's no ands, ifs, and about it. And another thing is also the brain plays tricks on you. You can read a word, you know what the word wants to be, and you misspell it, and you could have sworn it's spelled right, but your brain read it one way. It plays tricks on you. Well, it's been a pleasure to have you on the show.
Thank you.
If you can, we always have an author signing
Okay.
on
Thank
our
you.
show. Bring the sheet back up.
And it's the vendor.
So we have Sailing on Broken Pieces by Dr. Gary Rhule, another successful book and story.